name is Dr. Lester Hartman from Westwood-Mansfield Pediatrics. And remember, whatever we talk about today is strictly for those patients of Westwood-Mansfield Pediatrics. Your pediatrician may have a different opinion, and we suggest you go by them. Today we're going to talk about lumps and bumps on the head in the spring. Oftentimes parents will come in very worried about lumps behind their children's ears or down the lateral side of their neck towards the back of the neck. Oftentimes they worry that it's an infection, and some people even worry about cancer. Lumps behind the ears for some parents creates cancer fears. And I've talked to a pediatric cancer specialist, and he has said to me that he's never had a cancer present as a lump behind the ear. Though it's not impossible, he's never seen it. Now, what do lumps behind the ears in the spring mean? And down the side of the neck. Oftentimes what's very interesting is on the top of your head you have what's called a lymphatic system, which helps drain the skin and the deeper tissues. And those all go to the back of the head here and drain into the lymph nodes. So any bite in the head, anywhere in the head, will drain behind the ears. And you can have even up to dime-size lumps behind the ear. And those can persist for a few months. Occasionally, if they're cysts, they'll persist longer. It is extremely rare, though not impossible, for them to get red and to get to the size of a quarter and hurt, and that's when we need to see them. Or even if they get to the size of a quarter, we should take a look at it. But a dime size is not atypical, and it's rarely ever tender. Sometimes when you assess tenderness in a child, you just need to distract them and actually just grab their head right around the lump and go, "Hi, Johnny," rather than trying, "Does that hurt? Does that hurt?" Because then they'll go, "Oh, leave me alone, leave me alone." So it's very important that, when you assess, you grab the back of the head and push like that. Now, this is a typical springtime issue because the bug bites in the head oftentimes are the things that create this. Any cut, any bug bite, anything will drain behind the ears. And since spring is the time when black flies are out and mosquitoes are out, and oftentimes after rainy days, this is the typical time when you get bug bites behind the ears. Lumps behind the ears from bug bites draining from even the top of the head as well. So remember that this is not an atypical presentation. And it being anything serious is very rare, and there's really no treatment. It's just a tincture of time for the lymph nodes to shrink down themselves. If you have questions, if there's fever, or like I said, quarter size, or very tender and very red, then that's a different story. You should always give us a call with that. This is Dr. Lester Hartman from Westwood-Mansfield Pediatrics, proactive in your child's care. Empowering families for over 50 years. Thank you, and have a nice day.